In the first few days after your discharge, if you experience a worsening of your pain, develop a high temperature, or feel unwell, it is important that you ring the ward and ask for advice. You will be seen routinely in the surgical clinic for follow-up care. You will continue to improve at home, but try not to do any heavy lifting for at least 3 to 4 weeks. Try to eat healthily. Foods rich in protein help you to get stronger and heal faster. These include milk, fish, meat, cheese, and eggs. Complications do not happen very often, but it is important that you know what to look out for. During the first 2 weeks after surgery, if you are worried about any areas covered in this section of the video, please contact us or your GP. It is not unusual to suffer gripping pains called colic during the first week following removal of a portion of bowel. The pain usually lasts for a few minutes and will go away in between spasms. Severe pain that lasts for several hours may indicate a problem with your operation. This is a rare complication. If you have severe pain lasting more than 1 to 2 hours, or have a fever and feel generally unwell, you should seek urgent medical attention. It is not unusual for your wound to be slightly uncomfortable during the first 1 to 2 weeks. Please let us know if your wound is becoming red, swollen or painful, or starting to discharge fluid. Your bowel habit may change after your surgery and may become more loose or constipated. This should settle into a more normal pattern over a period of time. Your appetite will take time to recover after your surgery. You should eat small meals 3 or more times a day. If you have a stoma, the stoma care nurse will give you specialised advice on your dietary intake. It is important that you obtain an adequate amount of protein and calories to help your body to heal. If you are finding it difficult to eat, you may benefit from supplementing your food with 2 to 3 nutritional drinks a day, which can be prescribed by your doctor. We encourage activity from day 1 after surgery. You should plan to undertake regular exercise several times a day and gradually increase this during the 4 weeks following your operation until you are back to your normal level of activity. Taking up your hobbies as soon as possible again after surgery will also enable you to maintain your activity and will benefit your rehabilitation. The main restriction we would place on exercise or activities is that you do not undertake heavy lifting until 4 weeks following your surgery. Common sense will guide your exercise and rehabilitation. In general, if your wound is pain-free, you can undertake most activities. Many people are able to return to work within 4 weeks following their surgery. You would need to see your GP before returning to work. Do not drive until you are confident that you can do so safely. It is important that any pain has been resolved sufficiently for you to be able to perform an emergency stop and turn the wheel quickly in an emergency. If you have a problem or concern, or if you have any questions that have not been answered during the course of this video, then please contact us.